It's quite a lengthy process in order to run a group. So the ones that I've been involved in before, generally how it works is, so when I was in community dietetics, we would get referrals for patients. We would generally assess them and work out, do they meet certain criteria that we would think they'd be appropriate for a group? So it might be, you know, can they read? Are they able to concentrate for that long? Do we think that they would, I guess, fit well with the other group members is another interesting thing that you have to consider. And then do they meet the individual requirements of the group? So if, for example, if it was a weight management group, you know, what their weight is doing, do they have any other chronic diseases like hypertension or high cholesterol that might impact? So you do this really thorough assessment of your patients before you put them in for a group. Once you decide that they're appropriate for a group, you want enough patients that it's worthwhile, or enough people worthwhile, so you can run it. So once you get to that point, then it's about booking a room. When I used to do a weight management group before, I would conduct the sessions, and it was once a week for 8 weeks with one of the nurses at Community Health as well. So we kind of just shared the role. So there were presentations. So learning different aspects about weight management, so there might have been a bit on nutrition, and generally I would sort of sit on the floor with some food models and just talk to people about, these are some of the things that you need to include, this is what you can reduce to help you lose weight. We then would invite in different speakers, so there might be a psychologist that would come along and talk about behavioural management and how you can look at that side of things to change your behaviours and to improve your weight. We talked about emotional eating, so people that eat based on, you know, different emotions. So if you're sad, you might eat more, or if you're feeling stressed, you might eat less. So we talked about that. So yeah, different speaker each week, but the nurse and I ran it for the whole program. And what we did is along the way, so we assessed them initially, so we got their weight and blood pressure and cholesterol. We did that in the middle for the patients, and then at the end, so we assessed how they were going along the way. And then from that, it's always hard because you get to a point where these people become quite reliant on the group and they become friends, so we generally encourage them to form their own little group after that and to go away and meet and continue with their exercise program or whatever it is based on that. But yeah, it's a really enjoyable way to see people from the start learning new things and actually then getting the positive outcomes that they need, so not just weight changes but changes in blood pressure or cholesterol and things that will improve their health long term.